In this video, we're testing our diagnostic skills. Here's how it'll work. I'll present you with the details of a fictional case. Then you'll get some time to figure out what diagnosis you think is appropriate. After this, I'll provide you with the correct diagnosis for this case. Let's get started. But first, my name is Keegan. I have a master's degree in counseling and I'm a licensed professional clinical counselor. I make videos like this to help you better understand various concepts in the world of psychology, counseling, and mental health. Keep in mind that engaging with this channel does not constitute a therapist-client relationship. This content is for educational and entertainment purposes. This does not substitute or replace professional mental health care. Maya is a 28-year-old graphic designer who presents for an intake 10 days after a multi-car pileup on a major highway. Her intake appointment is taking place virtually as she's not been able to leave her home or get in a vehicle without extreme distress since the accident has occurred. Physically, Maya escaped the accident with only minor bruising. However, she witnessed passengers in nearby vehicles not fare so well and watched as they were extracted by emergency crews at the scene. Other passengers near her also received minor injuries, while others received life-threatening injuries, and at least one died from the accident. Maya was not the individual responsible for the accident taking place, and she was caught up as well as many others in the pileup. Since the accident, she reports feeling shattered and says that she feels as though she's unable to snap out of it. She adds that she feels as though her mind is stuck on the highway. Maya has not been able to return to work as she finds that she cannot get her mind off the accident. Throughout the intake, Maya states that she's been experiencing nightmares, and she says that she finds various sounds will replay in her mind, such as the sound of the metal crushing together as the cars hit one another. Maya says she feels dead inside and feels as though she has not been happy since the accident occurred. She describes the world as foggy and feels as though she is watching things from an outsider perspective. She says that she's been struggling to sleep because of the nightmares, but also adds that she doesn't want to go to sleep because she's afraid of the nightmares and wants to avoid these memories. She adds that since the accident has occurred, she's been very jumpy and startles easily. Maya appears tense. She exhibits a restricted affect and speaks in a low, monotone voice. She's oriented to person, place, and time, but her concentration is poor. She frequently loses her train of thought, being easily distracted by various things around her. She denies suicidal or homicidal ideation, but expresses a sense of hopelessness about ever feeling normal again. Let's quickly recap the case and then discuss the diagnosis for Maya. But first, if you're enjoying this video and finding it helpful, please help me out by giving it a like and subscribing. As a quick recap, Maya was in a multi-car pileup 10 days ago. Since the accident, she's experienced various symptoms that have continued over the last 10 days. Because of her fear of getting in a vehicle again, Maya has not worked since the accident. She's been experiencing nightmares, startles easily, feels like she's watching things from the perspective of somebody else, and has struggled with having any positive or happy feelings. If you're needing more time to review a possible diagnosis, now's the time to pause. Based on what Maya reports, she meets criteria for acute stress disorder. Check out the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, for more details on this diagnosis. Make sure that you subscribe, as in the next video, we'll be diving into acute stress disorder to learn more about this diagnosis. This is the end of the fictional case of Maya. This case presentation is for entertainment and educational purposes. Any resemblance that this case has to a real situation is purely coincidence. I hope that you found this video helpful. While you're here, check out some of the other videos on my channel. Thank you so much for watching.